Well, in Australia we have an epidemic of hepatitis C. More than 200,000 people in Australia are chronically infected with hepatitis C. The major risk factor for hepatitis C is injecting drug use. And because of this, the prevalence of hepatitis C in Australian prisons is high, more than 40 times higher than in the general community.
St Thomas is the outpatient department of St Vincent's Correctional Health here at Port Phillip Prison, and this is where the prisoners come to see me to get on hepatitis treatment.
So the two key factors in this current program are the simple treatments, so one pill once a day for most people with hepatitis C. And the other key factor is that this particular model that we're using in the prisons is driven by the nurses. So there are doctors involved in the program, but we're really only brought in for about 10 to 15% of situations. The nurses do the rest of the work. They assess the people with hepatitis C, they make the decisions, and we're really just brought in for complicated decisions.
Previously, the treatment was managed by specialists and we were only able to treat 10 prisoners a year, and it was at one central prison. This program now is nurse-led, so we take care to the prisoners. There's 14 prisons across the state and we travel to every prison across Victoria. Therefore, we're taking care and assessment and management to the prison sites, and this reduces prisoner transfer and therefore increases access.
Typical screening session at Port Phillip is me primarily looking at all the factors that might affect somebody's successful treatment in prison first. So I look at their age, how long they're going to be in prison for, so at what point of their prison journey they're at, because we want to get people treated primarily in prison if we can. Then it's doing a drug and alcohol assessment, looking at their other regular medications, and obviously having a really good look at their pathology results. And that gives us a good idea of where they're at with the level of disease progression they may have with their hep C. And then we do a fibre scan, and that puts all of the picture together, and we may have to order further tests after that, and they may need to see a specialist. So you're on one of the new tablets for hep C.
That's right.
Called Epclusa.
Yeah.
I'm just wondering if you can tell me how you feel now in comparison to how you felt before you start the treatment.
Yeah, but so far I feel good, and I'm actually very grateful. I'm grateful that I can be on the hep C treatment and get rid of my hepatitis C, because it's been worrying me, thinking it might eventually give me cirrhosis to the liver. Yeah. So just the way the outcome of it is going to be that I haven't got that hanging over my head, wondering whether it's going to kill me or make things a bit awkward for me in life with my health.
We've had a very high rate of prisoners opting into the program, and this has been the basis for the success of the program. There are two really key factors that have underpinned the success of this program. The first was the decision of the federal government to make new treatments for hepatitis C available to prisoners, and this has really been a very unique decision internationally. Australia is one of very few countries in the world where treatment for hepatitis C is readily available to prisoners. These new treatments are highly effective with cure rates of greater than 90%. They involve one pill per day for between 8 and 12 weeks, and they have very few side effects. The second factor that has really underpinned the success of our program is the decentralised nurse-led model of care.
I just wanted to have a chat to you about how you're feeling now.
You know, this environment, it's never easy to, with appointments and all the stuff that's going on externally. So I've found that you guys have been really good in keeping base with me, let me know what's going on, and yeah, it's been really good compared to other experiences I've had. It's been great.
Hepatitis C is pretty common in prisons. A lot of people in prison are there because of activities associated with injecting drugs, and particularly in Australia, hepatitis C is pretty common amongst people who inject drugs.
From speaking with the prisoners who are involved in the hepatitis program in the prison, in excess of 85% of them have never accessed specialist care for the hepatitis C previously. So it's engaging a population that traditionally hasn't engaged with care. The new treatments have been quite revolutionary. We've moved from treatments which previously were very poorly tolerated and had poor efficacy, which were around a year in duration, to a simplified treatment which is one tablet once a day, which is taken for 12 weeks only.
We see dramatic changes sometimes in curing people of hepatitis C. We can see improvements in their mental state. They feel much more energy, much more positive about things that are going on in their lives. Depression and anxiety seem to improve. And physically, we actually see them look better. So it may be my imagination, but they seem to look younger, more full of energy, and their skin looks clearer. It doesn't happen to everyone, but it can be quite dramatic.
The statewide hepatitis program is an initiative of the Department of Justice and Regulation of the Victorian Government. And I want to thank Justice Health, Corrections Victoria, G4S at Port Phillip Prison, as well as all the other Victorian prisoners and the staff of the prisons for making the statewide hepatitis program possible. This is an important initiative, and without their drive and support, it would not be possible.